Okay, well, let's get going. We have two people in the waiting room. I will start to admit them and we'll just let people kind of trickle in a little bit and then we will get started after a few minutes. Welcome to the people that are coming in right now. We are excited to have you guys here. We're going to wait a minute or two and just see if a few more people come in before we start our presentation. All right, everyone can see my screen, right?
Yes.
Okay, awesome. Everyone have a sip of water ready?
With my WBMxLazar glass.
I love that. I use mine all the time. Um, okay. Okay, we'll wait one more minute and then we will get started.
Oh my, there's a sink. So I was trying to take a picture and post again, but there's a sink, so it's not pretty. I'm gonna figure something else out.
Yes.
It must be very aesthetically pleasing.
Okay.
Well, you mean you were trying to take a picture of you with us or all of us?
Yes, yes.
Like kind of like this or like just the screen? Because I could do it.
Or take a screenshot.
I'll take a
I just did it.
screenshot too
Oh yeah. Take
and
a
hide them, people. Oh, yeah. Okay.
How's that?
All right. Well, as we're taking our screenshots, I'm just going to start getting going here. Welcome, everyone. Thank you so much for joining us tonight. I'm Catherine Staffieri, Head of Marketing here at Well by Messer. And on behalf of our co-host, Dr. Ina Lazar and Pro Eyecare, we are so thrilled to have you here for our College Ready Health panel. We pivoted from an in-person to a webinar, and I think hopefully with the weather forecast for tonight, that was a good call. And we're excited to have everyone joining us from wherever you are this summer evening. So preparing for college is a massive milestone, and packing dorm rooms and picking classes usually takes center stage. Taking care of your health is what keeps everything running smoothly once you get to campus. So tonight we're diving into the absolute essentials every student needs to navigate this transition with confidence. We have a fantastic panel of experts with us to cover four major pillars of student wellness: mental health, primary care, nutrition, and eye care. So whether you're a student gearing up for freshman year or a parent helping them prepare, you are in the right place. So let's get started. So our panelists tonight, our co-host is Dr. Ina Lazar. She is a leading expert on primary eye health and one of the country's most sought-after experts in the treatment of dry eye disease. She earned her Doctor of Optometry degree from the Pennsylvania College of Optometry, and with a focus on advanced ocular surface disease and myopia management. Soon after, Dr. Lazar founded Pro Eyecare, and oops, sorry, I lost my way there, along with the Dry Eye Institute, a specialty practice that offers the most coveted, technologically advanced, drop-less treatments for dry eye. We have Dr. Jess Kovler. She is a psychologist at Well by Messer and a professor at John Jay College of Criminal Justice, where she has won awards for her commitment to college students. She's considered one of New York's experts in cognitive, behavioral, and dialectic therapies, in addition to psychodiagnostic assessment. Using a scholar practitioner model, Dr. Kovler's treatment philosophy is rooted in two principles: decrease suffering and improve functioning. She's well-versed and adept at treating a variety of conditions and particularly enjoys health, wellness, psychology, and relationship enhancing work. And we have Dr. Rupal Chabra from Well by Messer. She is a double board certified internist and obesity weight management specialist who has been in practice since 2009. Passionate about providing comprehensive and compassionate care, Dr. Chabra focuses on building strong patient relationships based on trust and mutual respect. She remains committed to staying current with advancements in medical research and partnering with her patients to closely craft personalized, sustainable, and long-term treatment strategies to achieve optimal health. And finally, my partner in crime, Barry Wolf, is a registered dietitian with over 25 years of experience. Helping others modify their behaviors, mindset, and choices to maximize wellness is her passion. She began her career at NYU Langone Medical Center, where she was the cardiac dietitian, and then became the nutritionist for the NYU program for surgical weight loss, where she counseled clients undergoing bariatric surgery. She has counseled hundreds of patients and helped them build lifelong skills for making healthy choices. So welcome, everyone. Thank you to our panelists for being here. Thank you to our participants for being here. We are going to go through a ton of information tonight. While we want it to be interactive and fun, you can put your questions in the chat or save them till the end when we will have a Q&A. And we're just really excited to dive in. So let's get going. We are going to start with Dr. Chabra and talking about primary care for our college students. So really, this is kind of like a seminal moment for these kids or teens, young adults, however we want to, classify them. They are kind of leaving the nest and they need to navigate the healthcare system independently. So where should they go for what? I mean, you've got the campus health center, you've got urgent care, you've got an emergency room, you've got telehealth. Like, where would you start by talking to your your child or your patient when they're going off to college?
Absolutely. So I think it's really important, for most students, this is the first time that they're really managing their own health, making their own appointments. So understanding where to go for what type of symptoms is really, really important. You don't want to delay care. So starting first with the campus health center, that is where you're going to go for any everyday issues. It's often free at most campuses, or they have low cost programs available for their students. Things like the common cold, urinary tract infections, minor rashes. The right place to go for those things would be your campus health center. If you need a little bit of a higher level of care, the next thing and place to think about is the urgent care. So the urgent care is where you want to go to for anything non-life threatening, things that can wait. You don't need to rush to an ER, but require a higher level of care. So things like sprains, ankle sprains, wrist sprains, infections. If you're having a high persistent fever, especially above 103, that's not resolving, it's been lasting for a couple of days, you want to make sure you're going to an urgent care center so that they can do advanced testing, blood work if necessary. Cuts that require stitches can often be handled by urgent cares as well. Often this care is really faster than waiting in an ER for hours and much more cost effective. The emergency room you want to really reserve for life-threatening or severe conditions like chest pain, shortness of breath, any severe injury where you can't walk or bear weight. Of course, scarier things like overdoses, accidental overdoses during parties. Those really are 911 or directly to the emergency room. And then last, don't forget, newer technology exists. Telehealth care also exists. So if you have a great relationship with the primary care doctor at home, it's often easier to set up a virtual visit and do a telehealth visit with someone who knows you, who understands your health and history. A lot of mental health care can be handled through telehealth. And a lot of insurance carriers actually often offer telehealth options as well for simple things like colds and urinary tract infections.
And sort of talking about insurance, I think probably when I was 18, I was like, I don't know, I'm assuming I got insurance. I literally had no idea. I didn't understand any of that. What's your recommendation, to an 18-year-old going off to college or to their parents when it comes to like the real basics of insurance?
Yeah.
What should they know?
One thing I wish someone told me was take a photograph, take a picture of your insurance card, front and back, and keep it in your wallet. Any of these settings, whether you go to a school campus, urgent care, ER, that's the first question they're going to ask you is, do you have insurance? What's your plan? So just keep a photocopy in your wallet or your purse. And it's also helpful to have certain phone numbers stored in your phone so you're not looking for it at a time of need. Keep your local college campus health center phone number, your primary care phone office's phone number, all plugged into your phone in advance.
Absolutely. And, does it make sense? I know you have to upload like medical records and things like that. Does it make sense to kind of go through that with your kid before they go away? Or, I mean, I don't think I ever looked at like what my blood pressure was. I mean, I don't think I knew any of that when I was
Yeah.
going into, if anyone was like, are you healthy? I was always like, sure.
Absolutely. It's good to know the basics. It's good to know what your baseline is. So most kids have smartphones, open up a notepad and keep a little checklist of your medical history, your surgical history, especially any medications that you have either had side effects or major allergic reactions to, any medications that you take, really important to record. Baseline blood pressure. If you have some baseline blood work, keep it on file. This way, God forbid, you go to one of these centers and they say, hey, is this something new for you? You can say, oh, no, I've always had this versus, oh, this is a new finding. Often being in an urgent care and ER can be really daunting and scary. So even basic things like past medical history, medications or supplements you take, they may not come to your mind at that time. So it's easier to have it all written down, notepad. You can open it up and say, oh, here's my checklist. Here's my information.
So smart. Absolutely.
Mhm.
Great advice. Thank you. Okay, so, sorry, your annual preventative care checklist. So, what are some of the things that, college kids should be thinking about, either if they haven't scheduled their annual care visit or, just what at that age, what's age appropriate for that annual visit?
Yeah. So having a physical exam with your primary care doctor, I think, is especially important before you go off to college so that your primary doctor has an updated list of medical conditions, your medications. You've had a full set of blood work. So you make sure all your vaccines are especially up to date. So when you are in a college, infections spread rapidly, right? You're in smaller classrooms, you're in bigger auditoriums, especially if you're living on campus. Things like flu, COVID that seem pretty simple can spread rapidly through these campuses and dorms. So really important to make sure your flu shots up to date, making sure your meningitis vaccines up to date, HPV vaccines are up to date, that your tetanus shot is up to date. That protects you. God forbid you could have an injury with a dirty piece of metal, dirty nail, a knife injury while you're cooking. All of these conditions are preventable if you've had your vaccines are up to date. For women, it's really important to make sure you've seen your gynecologist, especially if you're sexually active. Routine cancer screening for cervical cancer starts at the age of 21. But if you're sexually active, it's really important to see your gynecologist before you go off to school to have all, routine STD screening should be done prior to leaving. Discussing birth control and various safe sex practices are really important to have that discussion with your gynecologist ahead of time. Mental health check-in. Don't wait till you have a major crisis. Check in with a psychologist and make sure that you're doing well mentally. Dental cleanings every 6 months, really important. Eye exams every 1 to 2 years, right? We forget that if you have impaired vision, that can actually really significantly impact academic performance. So important to have routine eye exams also every 1 to 2 years.
You're so good at leading us into analysts. I love that. I love that. Well, we will get there very soon with eye health because it is super important. Okay, so let's dive into some of the things that maybe college kids feel uncomfortable talking about, but we all know are part of the landscape in colleges. So, what are some substances? And honestly, though, this is something we've talked about internally here at WBMxLazar, is that there's a really fine line right now between like wellness and supplements that can actually edge into danger, right? And there's a lot of access to these things that maybe sound healthy, but actually can be, potentially unhealthy or, at different, obviously in many different ways. But so what are some substances that are safe to use at school and, kind of what is not safe? And we can talk about things like alcohol all the way to peptides, which are all in the headlines this week, drug safety, prescription drugs, not, illicit drugs, all of that.
right? So the really only things that are safe to take are things that are actually prescribed to you based on your history by your providers are absolutely safe to take. Remember things that seem relatively safe, like Adderall, Ritalin, that someone may take for their ADHD. Sharing those drugs isn't always safe, right? So we want to assume everyone's young, relatively healthy, and a lot of kids do take these stimulants to help them study and cram for these exams. But if someone has underlying heart conditions or other medical conditions, there might actually be a contraindication, and these drugs that we think of as relatively safe for us because they're prescribed us aren't necessarily safe for our peers. Alcohol is probably the most important one to discuss first. Remember, 1 in about 4 college kids actually do binge drink. So the definition of binge drinking is 4 drinks for women or 5 for men in a time span of about 2 hours. Now, this is a big common part of college culture. There's absolutely no shame. I think it's just very important that we discuss it and discuss how to do it safely. So unfortunately, the binge drinking period is really where we experience the most harm that can come from alcohol, right? Our decision-making centers, which is what's called our prefrontal cortex part of our brain, is actually still developing till about the age 25. So specifically during episodes of binge drinking, we really further impair judgment and impulse control. It's really important to think about how alcohol interacts with prescription medications, right? A lot of patients do take stimulants for ADHD, like Adderall, for example. Now, if you're mixing that with alcohol, that can significantly mask intoxication. You can feel like you can drink more and you don't necessarily feel drunk, but trust me, your judgment's going to be impaired. You never want to mix alcohol with sedatives or opioids. So if you're taking prescription sleep medications that have been prescribed by your provider or pain medications, you can actually significantly decrease your breathing drive and you can actually stop breathing. So that's very dangerous. When we think about vaping, so vaping has really overtaken cigarettes on campuses. Roughly 1 in 6 adults now uses e-cigarettes, and these cigarettes are really designed to be much more addicting than cigarettes themselves. The nicotine plus there's other chemicals in them that are very addicting. So you can develop a tolerance and a dependence much faster in a matter of days to weeks. And nicotine can increase anxiety. And then when you're trying to come off the nicotine, the withdrawal itself can also increase anxiety. Let's talk about peptides. So you mentioned peptides. There's so many peptides that are readily available now on the internet. So things like BPC 157, melanotan, growth hormone secretagogues, they're sold online for muscle gain, for tanning, for recovery. And we have to really remember that right now they are all unregulated. They're sold online. We cannot verify how pure they are. You don't know that the dose you're getting is actually what you're trying to put into your body. And we don't know what they do long term. There's very limited human research and data available on any of these peptides currently. I would say the next big substance to be concerned about is fentanyl, right? So prescription drugs like Xanax, Adderall, Percocets can be purchased online, Snapchat, you name it, all these social media outlets, and they can be purchased from peers, and they're really made to look exactly like the original medication, but they're often laced with a very dangerous drug called fentanyl. So 29% of fentanyl-laced counterfeit pills were tested by the DEA actually had a potential lethal dose that can cause you to stop breathing. So something to be aware of is that most states do legally sell what's called fentanyl test strips. They're even available on some college campuses where you can test what you're taking to make sure that it's not laced with fentanyl. It's also important to think about having Narcan on hand, right? When you go to these parties, unfortunately, there is a lot of opioid abuse. And so Narcan can very quickly reverse an overdose. There is zero harm from trying. If someone is not responsive at an event, you have your Narcan. No harm can come from trying it. So go ahead and try to keep a Narcan on site. A lot of campuses actually also offer Narcan for free to their college students. And if not, they can be bought at most pharmacies for around $40 to $50.
Okay. Wow. That's like, it's frightening, right? I
It
mean,
is frightening, but important to be safe, right? We have to accept that this is a big part of college culture. So how can we do it safely?
yeah. Yeah. And also just sort of the online wellness community. There's so much available that is for purchase, particularly we talk a lot about GLP-1s and things like that. And people can try and sell you stuff or, it's so important to do it under medical supervision, to have a doctor helping you out.
Absolutely, especially with peptides, right? So a lot of these peptides work through increasing blood vessels and flows and repairing tissue, but God forbid there's a tumor or cancer hiding somewhere, you can really essentially almost feed it and enhance growth. The reality is we don't know. We don't have human studies. Studies are really limited and done on just animals and really small scale.
Yeah, right. Thank you. And now, what are some strategies for STI HIV prevention? Sort of, what's important for sexual health, and then, what are some of the three big STIs, and what are four methods of prevention for them?
Right. So the three biggest STDs I think that we see are well, number one is gonorrhea and chlamydia. Really, really common amongst the college age students or anyone who's not using barrier contraception with sexual intercourse, and often really doesn't cause symptoms in men or women, especially men. Women sometimes can have burning when they urinate, discharge, some pelvic discomfort. Now, the good thing about really familiarizing yourself with these STIs is that there's treatment that's readily available, right? If you're going for routine testing and either one of these infections are found, it's a simple antibiotic course that will clear it. Number two, I would say, is probably HPV. That can increase risk of cervical cancer, throat cancer, anal cancer, and that is really preventable through being vaccinated. So this is most of the time by the kids get to college, they've already had their HPV vaccines. If they haven't, you can absolutely still have that conversation with your primary care doctor prior to leaving, or even once you're at school about becoming vaccinated. HIV, it's really important to test for HIV if anyone is participating in high risk behavior, so multiple sexual partners, men who have sex with men are at higher risk for HIV. And we have two options available here. One, there is something called PEP, which is post-exposure prophylaxis. So if you, God forbid, have been sexually assaulted or had an exposure and you're not sure of someone's HIV status, it is an antibiotic that you can take that reduces transmission. And there's what we call PrEP, which is pre-exposure prophylaxis. So if you have multiple partners, any high risk behaviors, you can take medications which are available either in injectable form or pill form that reduce HIV transmission by 99%.
I didn't even know that.
Yeah.
Fascinating.
And barriers, we talked about methods of prevention. So barrier methods, number one, right? Barrier condoms is the best way to prevent both pregnancy and STDs. Two, contraception won't necessarily help you with STIs, but certainly with pregnancy risk. We talked about the pre-exposure prophylaxis for HIV, which would be number three. And then number four, I would say routine testing. It's commonplace. Make sure you are being tested annually. If you've had an interaction with a new partner or have multiple partners, think about getting tested regularly.
Yeah. And not to be embarrassed by it. Like,
Absolutely.
to sort of take ownership of it and say, you know, this is just a part of my general wellness, running the whole gamut of testing and sort of trying to be proactive. Because I think that is kind of, you're trying to launch your kid out in the world, like how to take care of their money, how to eat well, how to, be a good person, be a good roommate. And some of it's like taking ownership for your own healthcare, right? And how to kind of take it, be your own agent for being your healthiest.
Right. And I think part of taking that stigma away is the parent initiating the conversation with their kids before they come off and normalize it for them. Exactly as you said, Catherine, make sure that they're having their annual, the GYN exam, the eye exam. Hey, let's include STD testing on that list.
Yeah. Yeah. I mean, it's, probably a little, oh, this is kind of awkward, like the first time, but,
Yes.
it's like, just got to do it, right?
Yeah, absolutely.
Awesome. All right. Well, thank you. We are going to roll into eye health. As we've talked about our whole body, we're going to go up into our brain, our face, and our eye health now with Dr. Lazar. And we are going to talk about vision and academic performance. We sort of touched on this, but can your eyes actually affect your grades?
This is such an important question because I talk to my patients all the time about this. Yes, because a lot of times, just because you're able to read the chart and you see well, such as 20/20, and we know that is the gold standard, a lot of times that is absolutely does not mean the patient has healthy eyes because it's an organ and it has so many different delicate structures. So even patients may have good vision. They could have a retinal disease, they could have retinal tear, they could have um, a freckle growing on the back of their eye, and they would not know unless they had that full comprehensive dilated eye exam. So that's just talking about the eye health. When I discuss this with my patients, especially young kids or children that going off to college, we test their binocular vision because yes, they may see well, but are the eyeballs, do they work as a team? Is the patient able to cross their eyes, sustain that crossed eye position throughout many, many hours? Because when we look out the distance, we actually have, we need to have aligned eyeballs that look straight ahead. Every time we look at anything up close, we need to be able to cross our eyes and then sustain that cross eye position for many hours, because usually the average student spends about 8 to 14 hours on screen this day and age. And actually, I've looked up and I've been, reading a lot because that is something I'm very passionate about. On average, a student, by the time they graduate college, they spend about 10,000 hours on screen. That's a computer, that's, social media, TVs. We're truly surrounded by screens. So being able to, yes, see is important, but being able to see comfortably, sustain the cross-eye position, be able to read efficiently, and actually comprehend what you're reading with the first try is not the case that it used to be because the demand is so high. Kids are really struggling with having comfortable vision.
That's fascinating. I can't believe that number. Like that is really crazy.
10,000 hours.
Yeah. I remember when I was in undergrad, there were no like computer. I mean, there was no like laptop. I'm a dinosaur. And so it was like obviously pen and paper, right? And then you had to like, maybe there was like a smart board, like woo, something kind of crazy like that. But then I went back to school for graduate school, and like literally it's like out of a movie. Like everyone sat down the first day and like opened their laptops, all the little young like dietetic, students. And I'm like the old lady in the back with my pen and paper, and they're all like typing away. And I was like, they live on their screens. Like that was their whole time in every lecture and, all the time studying everything.
Absolutely. And you know what? I did not grow up with a screen. I got my first phone 25 years ago, let's say. But my son, who's 8, he comes home, he's in second grade and he comes home with an iPad because that is how they do their math.
Mm.
So we're no longer so we used to see a lot of dry eye, and we used to see a lot of dry eye disease in older patients because as you get older, your tear production decreases. It makes sense. That is no longer the case. We see a huge population that in their, early teens with dry eye because of the screen use. Because when the child is on the screen, we don't blink as well. We actually stop blinking significantly, and that lack of blinking results in significant gland loss that is activated. Every time you blink, you activate these oil glands and they secrete the tears. But lack of blinking leads to gland loss and dry eye. So we see a huge young population influx of these children with swollen eyelids, chronic styes, red eyes that we have never seen before.
Wow. Wow. Oh, styes
That's
are the worst. I would be so embarrassed if I was in college with a sty. Those are so terrible.
Well, we see this a lot. And you know what? When you go off to college, and I like what Dr. Chopra said, definitely know where the urgent cares are, know where the emergency is, but also be able to communicate with your doctor. Telemedicine is huge. I see my patients on telemedicine all the time, especially when they're either traveling or they're away in college. Having that phone call or telemedicine call with your doctor, because they already know you, is huge.
Right.
Because I mean, yes, we need screens and we need to learn to live with screens, but also use it appropriately.
Well, that leads into the next question. What are some practical strategies that students can use to reduce that eye strain, knowing that they have to use their phones, knowing they have to use their computers? What are some strategies you talk to your patients about?
I'm a big advocate on full comprehensive eye exams, making sure before you leave for college to have your updated glasses prescription, making sure your glasses fit your face. It's so tempting to get a fancy, in style pair of frames online, but a lot of times they don't fit the patient's face and they end up with headaches. Making sure your contact lens prescription is up to date. Make sure you have a year supply of your contact lenses so that way when you wake up for your exam, you're able to have a fresh pair of, either glasses or contact lenses and perform appropriately. Eyelid hygiene is so important because yes, we all are very good at brushing our teeth. Eyelid hygiene is part of that. So, you make sure you wash the lashes, you wash the eyebrows, which allows you to remove all the dead skin and prevent styes. Because like I said, we're no longer blink as we should. And that just really trickles a whole array of things that could be prevented just by doing lid hygiene. When patients are on screens, we always say, please remember to take breaks. If you're looking and you're working on the screen, try not to do it for 10 hours straight. Have set an alarm and every 20 to 30 minutes, take a blinking break, try to look out the window. There's actually a term, it's called 20-20-20 rule. Every 20 minutes, blink, look out the window 20 feet away for 20 seconds. That just to have patients remember that. And as you do it, the more you do it, the more you become compliant with it, the more you follow it. Another thing, people are so good with peptides, and I like how, Dr. Chopra touched on that, all these extra vitamins, all these things that are being sold to them. But what we actually have literature on is omega-3s. A good quality omega-3 is so beneficial for overall health, but it is a building block to produce healthy tear film. So I always have my patients, I always advise, make sure if you can't take the omega-3s, eat fish, eat small fish, eat sardines, eat anchovies. I discuss diets with my patients, and then sometimes they're like, I thought we are talking about eyeballs. I'm like, yes, diet is part of your eye health.
Maybe just
So
don't
those
eat your
are the
anchovies
things.
in your dorm room. Maybe like eat the smellier fish outside your dorm room. Yes.
Perhaps, but you want to have that healthy diet to support the eye health because yes, we are, we're investing so much into our children, but if they're unable to see well, if they're unable to process that information that is coming towards them, what's good in it?
Yeah.
I also like taking pictures. I always say, listen, this is your glasses prescription. This is your contact lens prescription. Take a picture just in case there's an emergency. You're at someone else's, oh, whatever there could be. You can always pull up the prescription and perhaps see a nearing doctor and they maybe can give you something to carry you over till you get your own supply. I think pictures and phones, again, yes, they're perhaps working against us, but we really can't live without them because we take pictures all the time and then we refer to these pictures. So taking pictures is a huge practice, and ocular hygiene, clean the lashes, blinking breaks is super important.
And if someone's wearing contact lenses, like what are some of the biggest mistakes that they make? I'm going to guess, if I had to answer this as someone who used to wear
Yes.
contact lenses, you should never sleep in your contact lenses, right?
Yes, that is bingo. Because listen, that is one of my biggest pet peeves. One of the most severe eye infections that will cost patients their vision could be 100% preventable. And it's really sleeping in contact lenses, showering in contact lenses, and then sleeping in contact lenses. Also swimming in contact lenses, hot tubs. That is how people truly put their vision at such a risk. That's absolutely not worth it. That's why for my children, for my kids that I see when I say my children, it's my practice. I do treat them like my children. It's really, I do try to switch them if everyone agrees to daily disposables. I just really think it is their kids are so busy, and just being able to take out the contact lens, put it in the trash and not worry about cleaning them. It removes so much worry. I try to switch patients to dailies if possible. And that really has changed a lot of things. We do see less eye infections, but we still see them even with daily disposables.
College kids, what can you do? What can you do? Okay, so maybe wellness and prevention. We talked a little bit about, things that students should pack to protect their eyes. Sounds like maybe like a supplement or something like that, but like good, face hygiene and things like that are really important. And then maybe as parents, kind of what else do you recommend? Like what should I make sure my child does before leaving for
So
college?
if you wear contact lenses, definitely have a year supply of contact lenses or at least 6 months supply. So that way it doesn't put up too much in your dorm room. A backup pair of glasses. They need to have a pair of glasses. Even though they strongly believe they will never use them, let me tell you, they will because they're going to wake up from an all-nighter. Their eyeballs are going to be red. Or they will get a viral infection because, like Dr. Chabra said, it spreads very quickly. They cannot wear their contacts. And if they can't wear their contacts, they can't leave the room because they cannot see. So having an updated glasses prescription that fits their face is so important. Of course, sunglasses. I see, a lot of kids not wearing the sunglasses that again fit their face or truly protect their vision from UV light because what we're seeing a lot now, patients purchase their glasses on Amazon, which I mean, it's like a place to go to now. But some of them, even though they have dark lens, that does not mean they protect against UV light, which is very dangerous because if the lens is dark, it dilates the pupil and then a lot of UV light passes through and that is damaging to the retina. So good pair of sunglasses, a product for lid hygiene because lid hygiene should not be really done with a regular face wash. There are some surfactants in regular face washes that can cause lid irritation. And I'm also happy to recommend, make a recommendation on what those products are, but there are specific for eyelid hygiene, and you can see them once you go in the aisle to purchase at any pharmacy. Lid hygiene, of course, omega-3s and moisture drops. It's okay to use moisture drops. We're all been there. We all had, a late night of studying, and it's normal for your eyes to feel exhausted and tired and red. Just like you would moisturize your skin, it's okay to moisturize your eyeballs. Definitely don't abuse it. If you find that your eyes are constantly red and you've been using the moisture drop, go to that urgent care, go see an eye doctor. But sometimes it's okay to use. But also stay away from eye drops that get the red out because that can mask a lot of problems and they can actually trigger a more redness. So drops like Visine or anything that has a red cap, try to stay away from those. So those are my biggest ones that I think should be on every kid college list.
So helpful and probably maybe stuff that you don't really think about, right? If it's not something that you've, experienced in the past or something, it's just important to have that kind of stuff. And definitely don't share your eye drops with someone else. Like
Don't share the
don't
drops.
borrow your roommate's eye drops or anything like that. Get your own.
Also, don't share your contacts. I've had patients that say, "Oh, I wear my roommate's contact lenses because I ran out," and don't do that. And also wash hands because just like any viral infection spreads, um, it's important to wash hands to prevent that.
Right.
And STIs, you should wash the hands.
Yeah. Awesome. Okay. So we are going to continue to go up our body into our brain now, and we are going to speak with Dr. Kofler, who is a wonderful psychologist and has worked with so many students, college students at John Jay College, for criminal justice. And she is going to talk to us about mental health, which I think is really top of mind with many parents and students these days. There's articles, there's books, there's so much going on in this space for our teenagers whose brains are really kind of, you're like, well, are you an adult? Are you making adult decisions? Are you a teenager making teenager decisions? Like, and they're doing both. So, also what I will say is like the pressure to get into college, the pressure of that, SATs and applications and everything is so tough on students these days. And then to like sort of release the steam and go into college and have some fun. It's a lot to manage for these kids, right? Maybe this is the first time in a couple of years where you can have some fun in the fall and kind of take different kinds of classes. But college comes with a whole host of different kinds of stress. And so would you please talk to us about sort of normal stress versus a mental health problem? How do you know, either as a parent or a student, the difference between normal college stress and a mental health problem that needs treatment?
Yeah, this is a really good question. And when we're talking about emerging adults, that's at 18 to 25 period, there's so much that's happening for them, right? In terms of their emotional development and physical development, entering the world. There's so many changes that are happening. And the idea is, what is the difference between what's normal stress and something that really requires treatment? So just a couple things before we get into that. I think it's really important that parents get a FERPA release because sometimes a young adult does not realize that they are struggling. Perhaps they're having prodromal symptoms, which we'll get to in a moment. So, access to their education information can tell you if something's going on, perhaps before they even realize it, right? Because they stop sleeping, grades start slipping. And if at least you're able to kind of see, that's something that's very helpful. Of course, we want to encourage independence. This is a time to build resiliency, for sure. But I think having that access to be able to look at grades or talk to the folks at college, the deans or whatnot, is really necessary. But again, let's balance that. We don't want to be helicopter parents, but we also want to be able to check in if, God forbid, there's a concern. So there's kind of a balance there. The other thing I think it's important to mention, it's great sometimes if young adults can say that they're struggling. And again, we're going to talk about when that warrants clinical attention, but there's sometimes where it's not. So we need to remember that between 18 and 30, we often see the development or really the presentation of bipolar disorder, schizophrenia, psychosis. And if there's a family history, it's really important then to be looking at your youngster and figuring out, are there any prodromal symptoms? So if you're noticing that your child is withdrawn, perhaps, or starting to think a little bit differently, this is the time to make sure that they're okay. And this is not to instill fear in anybody, but actually we need to be aware of this, especially if it runs in families. And as people experiment with psychedelics or things like that, that can also bring on a psychotic episode. So I just think it's important to be in that realm. But then if we look at the other, what we call axis one diagnoses, if you're noticing that you're not sleeping, right, difficulty eating, and I look at social functioning and occupational functioning, are they able to contribute socially? Are they able to contribute by going to class? So if you start to see those things wavering, that's the time to seek help.
Because sort of normal college stress can be like, I don't know, I don't really like my roommate, or oh my God, I'm trying to brush a sorority, or like these friends aren't as awesome as I thought they were going to be, or like this school is like way overwhelming, or maybe it's too small. Like maybe those are more normal stresses that your kid can handle. But could spiral into something bigger. I mean, if your teen calls you and they're like, "I think I chose the wrong school. What's wrong?" That maybe is more of like a normal stress and something you can talk to them about. But if they're like not returning phone calls or not kind of going to classes, those are more red flags. Would you agree with that, or?
Yeah, for sure. And here's the thing, we want people at this age group to really challenge themselves. This is a time where they don't want to have to call home for everything. So I think there's a bit of a process of saying, you can do this. You can talk to your roommate. You can handle this.
Yeah.
And so there's a back and forth. It's a delicate dance. There's no rule book for this. But yes, there are normal stressors, roommate, professor they don't like, getting into a sorority, something like that for sure. But we have to also pay attention to when is this going too far?
Yeah. I think the other thing that is so difficult, not when I was in school, but now the sort of like you can see on social media, maybe your best friend is having the most amazing time at school, an ex-boyfriend is posting like, whoa, like look at all my hotties, whatever. Oh my God. Like whatever. There's
Yes.
like we didn't have that, right? And so I think that adds a layer of stress for these kids to navigate. And they're familiar with social media. It's not like they haven't had that before, but there's an element of like grass is greener perhaps when you're making these big transitions in life.
Yeah, for sure. That's a really good point. And, not to date myself, but I remember sitting at Yale. I know the classroom I was in at that time, and someone said, "Hey, I have an invite for you. Have you heard of the Facebook?" I said, "What is this thing? The Facebook." And at that point, it had been at Harvard, MIT, and then it came to Yale, and it was very different than what it is now, for sure. But yeah, that was the first intro at that time to social media. Uh, but I always say to people, when are you posting on social media? You post on social media when your day is a 10 out of 10, it's the best day ever, or you're posting when it's a 0 out of 10 and it's your worst day ever. Go on and look at people's status updates. Does anybody post, "I'm having an average to mediocre day"? No.
Right.
So I always say to people, when you're on social media, you're busy looking at other people's lives while actually missing out on your own. So I encourage them, one, recognize the source of your information, 0 out of 10, 10 out of 10, right? But then also that it might not be, it's filtered.
Yeah. Yeah. And I think, maybe some of these kids are coming from a school that hasn't allowed them to have phones maybe in the classroom or something. Now they're sort of allowed to have their phones all the time. I mean, there's just sort of different rules with kind of that access to technology and stuff.
That's true. Self-regulation and impulse control are not usually associated with that 18 to 25 age bracket. And
Right.
here they are for the first time with access to, alcohol, or perhaps it's not their first time with access to it, access to cell phones, access to freedom, access to go to bed whenever they want. And so there's a lot of measuring and figuring out what one's limits are.
Yeah.
And definitely, I think with cell phones, can become all-consuming. Yeah.
Okay, let's go to our next question. So, what are some of the biggest mental health mistakes students make during their first semester?
Yeah, that first semester is such a unique time. I think we can all remember back. We remember our first semester. We don't really remember necessarily our fourth or fifth, right? Very, very, there's something very unique about that. The biggest mistakes I would say is isolation. Right? Things can feel quite overwhelming. For me, I find with my college students, it's waiting too long to ask for help. Those who are help seekers, appropriately so, tend to have a better experience and are more successful in college. It's the students that go to office hours. Everyone says, "Oh, who goes to office hours?" You need to go. You meet a professor, and the professor serves as a bit of a parent, right? When someone's away from home, and they could check in on your child. So definitely go to office hours, but isolating and waiting too long are some big red flags. Excessive social media, right? If you're spending your time looking what other people are doing and not living your own life, that's problematic. And then let's not forget sleep deprivation as well. Right. All-nighters can be a lot of fun until they're not. So we really have to look at the impact. And I appreciate you want to go out, you want to party, you want to do things, but let's not forget you need that time for your brain to, regenerate and calm down.
I know our picture here of our student with her coffee cup late at night is not a very good model of good behavior during the first semester.
It's
Okay.
true.
So what psychological skill predicts success in college even more than IQ?
Oh, I love this question, right? Because we have IQ, we have EQ. So when we look at what is really going to be helpful, way beyond just the straight IQ, conscientiousness, staying on top of things. And we can talk about systems and ways to implement that. A big thing is emotion regulation skills. Are you able to regulate your emotions? Something that I do with a lot of the patients here in the practice is we do a getting ready for college seminar. And we sit and we talk about their functioning now. We identify areas that need some growth, and then we start to do some skills. We spend that summer before really learning strategies. This way, when you're put in the academic environment, it's a new social experience, you can figure out, can I regulate my emotions in the face of significant stress? So definitely being able to regulate emotion, flexibility,
Yeah.
right? You have a vision of what your dorm room is going to be like, what your roommate's going to be like, what your classes are going to be like. Right. So being having flexibility there. Recognition that you're not going to necessarily be the best student in the class. Right? I remember when I was a grad student, I got to Cambridge. I was so excited, and I looked around. And between a day, I had imposter syndrome. I can't do this, and I realized because every kid there was also the valedictorian or the class president or whatever, and it could be a very intimidating environment. So remember, you're in the big leagues now, right? You don't have to strive for perfection. You have to do your best. Staying persistent is another big one. Right? Again, college teaches more than just straight academic, that's the life skills. And then, as I said before, it's really those help-seeking behaviors, knowing when to reach out. I'd rather have a college student ask me too much than ask me too little or nothing at all.
Even in the big lectures, even in the biggest lectures, you can still be, you can still be known and seen and heard, and someone can, you can connect with someone, a professor, a TA, another student. Yeah.
For sure. Get to know your TA. And again, I'm such a proponent of office hours. It's so, so important. And then, we're asking what predicts success even more than IQ. I do want to put in a plug, though, for knowing one's IQ. And more specifically, sometimes we do a psychoeducational evaluation. There might not be an academic or social concern, right? Sometimes people come in, they seek accommodations or things like that. But there's an assessment that can be done to figure out your cognitive strength and weaknesses. How are you in your fluid reasoning, your working memory, your attention concentration, and all these different areas of cognitive functioning? It's a good baseline at this age anyway to have this information, but also you can recognize your strengths and weaknesses and areas of growth and what you should focus on in college.
That's so smart. I didn't even think
Yeah.
about that. Yeah. Yeah. Well, I think the mental, the sort of the social mental aspect of living together in a dorm can be really, really foreign to a lot of kids, and sort of not having, mom around or dad around, or your coach, or, your buddies, your teammates, and kind of having to navigate being sad or lonely, or having a bad day, really all on your own, is a real moment of growth for students, but also can be scary for them.
For sure. And again, I look at the DSM criteria for any diagnosis of mental disorder, and we look at that social occupational functioning. So
Mhm.
it's okay to have a bad day. What was that song from Friends? Or a bad week, but not a bad year. So if you notice that you're not going to class, you're not participating in certain things, that's your cue to seek help.
Right.
And then, how to seek help on campus. There are campus help centers. I think it's important if someone has a therapist already to continue that relationship when they're at college. I think college support centers are there in a pinch and they can be helpful, but your child may also want to have longer term or more intensive treatment. But they are a resource on campus. It's important also to know you can always, message 988 or call 988 and have that resource available. But don't hesitate if you're concerned about yourself or a friend, you take yourself to the campus health center. It's important to get assessed.
So important. Absolutely. Yeah. And again, also as someone, you might not have ever seen anyone with depression before, or anxiety, having someone having an anxiety attack, or, so as someone living in that community with people, it's important to then exercise sort of like respect and, help and support and whatever you can do if someone is going through a mental health, situation.
And of course, I would rather people reach out for help and, your roommate have a bad night having to explain themselves to a counselor or something like that than actually not pursue help and have to deal with the deleterious consequence.
Yeah. Yeah. And that's something that parents can talk about, it's like, maybe, in our family, we don't have depression, or we happening, but that might be something you see
Mhm.
as you embark, in this, in college. So it's important to be able to talk about it and, not make anyone feel bad, and to be a supportive person.
For sure, for sure. And one thing I didn't mention before that I think is important to talk about is also hygiene. Because again, sometimes someone doesn't realize that they're depressed or struggling. However, they haven't showered in a few days, they're wearing ratty clothes. So what is that balance between normal college wear of the sweatpants and the t-shirt, right? When it goes on too far. So that's going to be another cue, I think, for students if something's going on.
Yeah. Yeah. And as a parent, if your child's coming to you saying my roommate's acting so weird and sleeping all day and not doing much, that I think sometimes parents don't realize they have to help their kid navigate situations like that. And that can be hard too as a parent. So as a parent, reach out to a psychologist, ask for help, ask for tips to help your child navigate these situations.
Yeah, no, for sure. Couldn't agree more.
Mhm.
Okay, I saved the best for last. My favorite, nutrition. So Barry, you have a daughter in college
I
and
do.
you have a daughter in high school, so approaching college, so you are familiar with what it is like to eat and have your daughter help navigate all the different various forms of eating in college. I feel like in college now, especially with like Uber Eats and the like readily available delivery services, Grubhub, all of it, DoorDash, like kids have access to way more food than we ever did in college. It was like you were on the meal plan or like you lived maybe in an
True.
apartment and you cook for yourself. So what are you seeing? And what are some of these habits that we could talk to our kids about as they're going into college? What is like one of the single best nutrition habit for college students?
Yeah, well, first of all, like we all know that when you go to college, everyone's schedule is so different. It's not predictable. You could have a class at 8 a.m., then you could have to go to work, you're rushing a sorority, and there are people that just go hours and hours without even eating. And we all know that when we don't eat, your blood sugar is low, you're getting cranky, you don't feel great. Your cognition certainly isn't at its peak when you're trying to learn in a classroom. So, the biggest thing that I tell my clients first or the parents is just make sure that you're eating regularly and that you do not skip a meal. It's so important. There's so many new things for a college student to navigate, but just telling them that we think you should eat every 3 to 4 hours. We want you to fuel your body and give you the energy that you need to do all these important things that you have to do when you go to college. We talked a lot about screens and the phone. I always tell my clients and my children, especially in college, like you wouldn't go without charging your phone, right? The food for us is our fuel, it's our charge. So all day long, if your battery is on zero, you really can't perform any tasks, you can't function. So that's the biggest thing that I tell my clients to do. Eating every 3 to 4 hours. It doesn't have to be complicated, even though we know they have access to legitimately like every kind of food imaginable. It could be as simple as grabbing a banana and a little bit of nuts. It could be having yogurt and a fruit. It could be grabbing a sandwich. It doesn't have to be complicated. It just has to be hopefully something that's protein centered and that's of course balanced that we get into when I'm meeting with people that's just giving them the fuel to carry out their day. So that's the biggest thing that I would tell people to do.
And I think, you and I have both counseled students kind of, in this time frame and it translates, right? Because then we counsel people that are in their 40s and 50s and they're like,
Yeah,
no, I haven't eaten regularly in decades.
yeah,
That habit gets baked in that when
yeah,
things are unpredictable or life is stressful, like the regular eating flies out the window, right? And
totally.
if you can
Yeah.
build that regular habit of like, it doesn't have to be 3 meals a day. We're not saying that,
Hmm.
but like kind of, being like I'm fueling myself in the morning, I'm fueling myself midday, that those habits that they can build in
Yeah.
college, they carry through, right? Like
And
we
like
see,
all and
yeah.
like all the things we're talking about, like when we're sending a student to college, we are preparing them for the real world because one day they're not even going to have all those adults that are around them in college. They're going to be the adult. So we're really preparing to build healthy habits that hopefully when they're in their 20s and 30s and so on, it just translates and they carry these big things with them. And you're right, sometimes I do talk to adults that aren't doing that either. And the good thing is it's an easy thing to tell your kids to do. It's something that they listen to if you tell them why. We always want to tell them why we're telling you to fuel.
Right.
And and for immunity, right? If you're not going to be eating, hopefully a well-balanced diet, your immune system is not going to be helped. And we all know that we're around germs. It's such a small living quarters. They're surrounded by so many germs. So just having a good immune system and fueling yourself properly is something that could help them too.
So important, absolutely.
Yeah.
So let's talk like specifically, like what does a healthy college meal look like? There, you have a dining hall. There's like study snacks. Like you might not have very much money, like to
Yeah.
budget out in terms of sort of dining out with your friends or something like that. Like, what are some of the things that you recommend?
So I always tell my clients, my students, Healthy, just we want balance, first of all. Some people think, oh, if it's I'm eating healthy, I have to eat a salad. And I want them to know that's not what we mean. We basically, when I meet with students, I'm giving them a little nutrition 101. Hopefully, they've in their health class throughout their high school years. I usually like ask them questions like, tell me what you do know about general basics of nutrition. I'll give them a nutrition 101. But I really want them to have trying to have a balanced meal, which when you're eating at these dining halls, right, which haven't really changed much then from we were in college, they might have gotten though a little bit healthier, and now they usually note what foods are healthier choices, which is very nice. They offer vegetarian choices. Now a lot of the time, fruits and vegetables are usually readily available. But when you're in a dining hall situation, I want to make sure that they're not treating it like an all you could eat buffet either, because that could happen too. They want to try a little bit of this, they want to try a little bit of that. So something that I usually give my clients, and this is something that like it's like a nice teaching tool, is something called the plate method, which again, it's something that I'm also teaching with my adults, it's of any age. But this is a really nice thing that I talk to with my students, that when you're building a plate, a half of it should be with the high fiber, nutritious vegetables that are giving them vitamins. A quarter of it hopefully will have some lean protein. They could definitely find this in their cafeteria, whether it's chicken or a lean, maybe a turkey burger or fish, hopefully, if they have that. And then the other quarter is going to have some kind of a high fiber whole grain, maybe brown rice or whole grain pasta or from roasted potatoes. I'm talking that's the easiest thing to do is build a plate, which they can do in the dining halls. But let's face it, they're also ordering from Uber Eats, so they're eating in their Starbucks. So I'm just trying to get them to center their meal around protein and a whole grain. And then I'm telling them, look at your meal, make sure it has a fruit or vegetable. Like it depends on who I'm working with, but that could be the first thing we do. At every meal, make sure you're adding in a fruit and vegetable. So if they're going to a place like a Subway where they're having a sandwich and then maybe they're getting some cookies or chips with it, I'll tell them, hey, why don't we try to get a fruit with it this time or a side salad with it this time? It doesn't have to be perfection. It just all those little things and those little moments add up to just making it a healthier routine. All those little changes, those little tweaks. And a lot of them, they want to feel good because they know that when you're eating the fried food or the fast food, I talk to people about how are you feeling after you're eating those foods. So again, that's a lot of it is the why. We want you to feel good and we want you to have the energy to go out and to go to your classes and to make friends. So hopefully that's their incentive also.
Totally. I feel like if you had like a giant cheeseburger and fries and like a milkshake, and you have like an hour and a half lecture with like the
Yeah.
lights off, oh my God, I would never stay awake.
You feel sluggish, you feel
Right.
yucky, and we want them to feel really good.
Right.
And another thing is that, I always tell my students and again my adult clients, like, where's your water bottle? Show it to me. Like I always do them like cheers with whoever I'm speaking to. Most of the students these days, like these kids are so savvy, they all have a water bottle that they're carrying around, but some aren't. So you want to make sure that they're hydrated. It helps with constipation. It helps keep your energy levels up. It's important. So drinking water, versus like juice or excess caffeine is something else that I'm telling them to do as well, of course.
For sure. I remember when I was studying like little kid nutrition, like toddler nutrition and picky eating and everything like that. And everyone was like, oh my God, I like forced my kid to eat all this stuff. And I remember reading this research that kids whose parents modeled healthy behavior, whether they ate the broccoli growing up, whether they were the pickiest eater, they ate like no vegetables growing up, the ones that went to college and probably ate the healthiest were the ones that where that behavior was modeled by their parents. It wasn't whether they
True.
ate it. So it was like they knew, like they had watched it their whole lives, that their parents had had balanced choices,
Mhm.
colorful meals, and it didn't matter if they had ever put it in their mouth, right? But when they're on their own for the first time, they're making those healthy choices for themselves.
Yep.
So, as a parent, continue to model that healthy behavior, right? Model healthy alcohol intake, model water intake, model all of that for your kids.
And moderation and fun foods too.
Totally.
Like you
Totally.
don't want them to feel like it's off, off. No, you can't have that. Like, just like I tell people, if you want to have ice cream, go out to get an ice cream cone. Don't keep it in the house if that's too hard because they're eating it maybe too much. So have them see you enjoy the treats as well, because I really do believe in all food fits, everything in moderation.
Right. And I
And you
do
know,
think we're going to talk about this actually in our webinar next week, but there are some eating disorders that can for sure come
definitely.
when students, men and women, are on their own
Yep.
for the first time, making those decisions, being in different environments, that kind of stuff. Yeah.
Yeah. Yeah.
Okay, what foods should every student keep in their dorm room? Hopefully not to get mice or bugs or anything, but
No, no, no. The good news is that, again, just like how I tell people in your office, in your kitchen, make sure that it's set up so that you're creating the healthiest environment that supports your eating goals. Their dorm room, hopefully, just like we pick out the comforter, you want it to feel like home. We hang up their pictures they like. We also want to set them up so they have foods that are going to be hopefully affordable, that can make easy, quick little meals or snacks, and that are nourishing. Most of the dorm rooms now have a little mini fridge, and a lot of the students now have little carts that are above ground level, so you're not getting any issue with mice, of course, because that is an issue that we don't want to deal with. But if you have a refrigerator, it's a game changer. We tell them to stock it up with protein like cheese sticks. You could do cottage cheese and yogurt, hopefully, if they like it. Some of these kids live near like delis that they even put in the sliced turkey in there as a little snack. We tell them to keep hummus in there. They could do protein drinks if they like that. And then as far as keeping things that are just at room temperature, like I brought over what all my college kids, they have some instant oatmeal, they have high fiber cereal, some peanut butter, some nuts, popcorn or microwave popcorn. You could really get creative and have things so that they're not going to the vending machine. They're not over ordering, all these crazy fatty foods or pizza 12 o'clock at night. It also is a way to be some social. Come in my room, I'll make us popcorn, or I have some, yogurt and cereal. We could grab this before we go out for class in the morning. A lot of the boys and girls that I work with, they have breakfast in their room because sleep is so important, and a lot of it's just easier sometimes to just grab the breakfast in your dorm. So it's so important to just encourage them to have that healthy setup and to take it along, just like when we're traveling, take a snack along in their backpack so that they're just remembering to eat those healthy options.
that's that executive functioning that might not be quite there yet, but we can continue to
Well,
remind.
that's why, like, to Dr. Culver's point, like that's why, like a lot of the relationships that I have with my teens, I see them in college. Like it doesn't have to be, you could check in with a dietitian, once a month. Because it is overwhelming when all of a sudden you have all these food choices. You're not on a strict schedule. You really have to, that's executive functioning. You're right. You have to create a schedule for yourself. It's a lot to do. So sometimes just having that person to help them makes it a lot easier. And they do have dietitians on all campuses. There's one at all the campuses because they're in charge of making sure the dining rooms are, well equipped to handle all of people's, food needs and allergies. But again, it's nice to work with someone that really knows you from home. But in a bind, they do usually have dietitians that will work with students on these campuses.
Yeah, yeah, for sure. Um, okay, well, I think that is the majority of our scheduled questions. So thank you guys so much for sharing your expertise. Does anyone in the audience listening, does anyone have any questions? I saw that there was one in the chat, but maybe that got answered. Um, a question for each specialist when I talk to my daughter later on. What is one wellness habit you think has the biggest payoff for incoming college freshmen, but is the most commonly overlooked? Does anyone want to take a?
Sure, I would say Exercise, exercise, exercise. Cannot stress that enough, both for physical health, mental health well-being, for improved sleep, which is important for your physical and mental health well-being. I wish I knew now at this age, in my 40s, I wish I knew my 20s that even as a female, I really should be focusing on strength training, which is so important. I know that it's tough, balancing college, new friends, events that you're going to, and your exams. But, even a 15-minute brisk walk will go a long way. Any little activity that you can add to your day matters. And if you can manage to go, access to a college campus gym, 3 days a week of just a little bit of strength training will go a long way in terms of building and preserving lean muscle, which when we think about long-term health, right in our 20s, we're not necessarily thinking about the things that are going to impact our health long-term in our 40s and 50s. And that lean muscle mass is so important for our longevity and maintaining healthy metabolic health, right? Preventing blood pressure, sugar, cholesterol, all these things that affect our health long-term starts early on. Preventing it starts early on. So both for my men and women, get to the gym, lift weights.
I love that. Healthy habits, they start in college. Yeah.
Yeah, and that's something that I'm embarrassed that I didn't mention that because I should have. Movement is almost good for all of our areas that we just talked about. It makes them, when I, talk to people, I'm trying to say what movement, even if it's just 30 or 15 minutes walking. A lot of the students now, like I said, kids are so savvy, like more than we were. They do want to go to do classes. It's a social thing. They could do it with their friends. They are lifting some weights. But yeah, even a walk outside for your mental health, for weight control, just for mental health and feeling good or connecting with someone else, it's such an important thing to keep doing in college for sure.
Great for stress management, really a great natural way to
Yeah.
reduce stress.
Yeah.
Sure. And I would agree with that. There's bilateral stimulation across the body. We use that in EMDR and other ways to regulate the nervous system. So I can think of no better way to do that actually than walking or running.
Oh, Ina, you're muted.
I say, I like how everyone is saying 15 minutes. I'm just asking for 20-second screen break. And you can't believe it's so hard to do once once you're studying, it's very hard to break that concentration. But try to remember 20-second screen breaks.
I love that. And the screen break from your screen means don't look at a different screen. Don't go from your computer to your phone.
Thanks for clarifying. I also wrote in the chat. I wasn't sure if we're going to address it, but really, make sure the biggest takeaway is make sure the eyes work as a team. Make sure the eyes work together because that is something that we see all the time. Patients complain of headaches or eye fatigue, where it's just their eyes need a little bit of fine tuning and teach them how to work together.
Absolutely. Well, thank you all so much for your expertise, sharing your expertise today. I mean, I feel like I would have really had a better undergrad experience if I'd taken my health more seriously. No, I had a great undergrad experience, but I feel like it's different now. I feel like you're right. Like they're more savvy. There's just more out there. They kind of know a little bit more. Maybe they're doing more Pilates than I ever did. But I think that there's a wonderful way that parents can support their children's health and that we can help them kind of become their own health agents. So again, thank you guys for sharing everything. I really appreciate it. Thank you guys for joining us. And we are recording this. So if anyone wants the recording, please feel free to contact Well by Messer, any of our offices, and we can share that recording with you.
Thank you so much.
All
I
right.
really did.
Thank
I learned a lot.
you.
Great. Thank you so
Thank you.
much.
Bye.